As we gracefully navigate the later chapters of life, visits to the doctor naturally grow both more frequent and profoundly important. Yet, a startling truth often remains hidden in plain sight. Many seniors inadvertently compromise the quality of their own medical care, not because of a specific ailment, but due to the seemingly innocuous words they utter within the doctor's office. Physicians, despite their dedication, are human. They listen with trained ears, but also form swift judgments based on how symptoms are articulated. Certain well-meaning phrases, spoken with the best of intentions, can unfortunately pave the way for misdiagnoses, frustrating delays in essential treatment, or even cause your legitimate concerns to be dismissed or taken less seriously than they truly deserve. Today, we're going to bravely confront 5 profound, albeit uncomfortable truths about what seniors should absolutely never say to their doctor. Understanding the underlying reasons these phrases are so detrimental and consciously choosing to adjust just a few words in your communication holds an astonishing power to safeguard not only your physical health but also your cherished dignity and, in some critical instances, your very life. Prepare to transform your approach to healthcare and empower yourself with the vital wisdom needed to age safely and confidently, ensuring you consistently receive the attentive, thorough care you truly merit. Our journey into these critical communication errors begins with a phrase that many seniors utter almost instinctively: "It's probably just my age." This seemingly harmless declaration, often intended to avoid appearing demanding, dramatic, or even a hypochondriac, unfortunately sends a silent yet potent message to your doctor that your reported symptoms are negligible, unimportant, or unworthy of serious, in-depth investigation. It creates an immediate mental shortcut for the physician, potentially leading them to prematurely attribute significant health changes to the natural course of time rather than an underlying treatable condition. However, genuine and often urgent issues like persistent nagging pain, sudden or recurring episodes of dizziness, concerning memory lapses that impact daily life, or debilitating, unexplained fatigue are far from automatic or inevitable aspects of normal aging. When you, the patient, preemptively dismiss your own physical or cognitive distress, medical professionals are regrettably more inclined to follow suit, leading down a dangerous path where legitimate conditions remain undiagnosed and critically important treatments are tragically delayed or entirely overlooked. Doctors fundamentally depend on patients to provide an honest, unvarnished, and complete account of their health problems. While aging certainly introduces certain physiological changes that are normal, it should never serve as a blanket explanation that substitutes for a thorough medical evaluation. Your unique body and its evolving signals deserve diligent attention, respectful consideration, and professional scrutiny, not convenient, self-imposed excuses that can profoundly jeopardize your current and future well-being. Following closely on the heels of self-dismissal is the second incredibly harmful phrase: "I don't want to be a bother." Seniors frequently utter this out of a deeply ingrained sense of politeness, a reluctance to impose, or a genuine fear of being perceived as difficult or high maintenance within a busy medical practice. However, it is crucial to reframe your perspective on healthcare. It is not a favor graciously bestowed upon you. It is a fundamental service to which you are entitled, a professional exchange where your health is the primary focus. When you consciously or unconsciously downplay your concerns, needs, or symptoms by suggesting they might be an imposition, doctors may, often inadvertently, shorten their evaluations, rush through examinations, or even omit crucial diagnostic questions that could uncover vital information. History is replete with examples of serious medical conditions in older adults that were only discovered because a patient, despite their reservations, bravely insisted on being thoroughly heard and examined. By signaling that you don't wish to bother anyone, you effectively train others, including your healthcare providers, to potentially overlook or ignore your legitimate health issues. Your health and comfort are never an inconvenience. They are the very core reason for the medical profession's existence, and you have every right to assert your needs without reservation. The third phrase that seniors should actively strive to eliminate from their medical vocabulary is, "I'm fine most of the time." While this statement might seem reassuring or designed to present a positive outlook, it tragically obscures the very critical details that a doctor desperately needs to form an accurate diagnosis and treatment plan. Medical professionals require precise information, specifically when your symptoms occur, how frequently they manifest, their exact duration, and crucially, their severity, especially on your worst days. Offering a broad generalization like being mostly fine can inadvertently create significant confusion, paint an incomplete picture of your actual condition, and ultimately lead to frustrating delays in receiving appropriate care. Instead of minimizing your experiences or trying to put a brave face on persistent issues, practice being meticulously specific. Detail what happens during your most challenging moments, describing the intensity and impact of symptoms on those difficult days, rather than focusing solely on the periods when you feel relatively well. Many insidious conditions commonly affecting older adults can appear deceptively mild at their onset, only to accelerate and worsen rapidly without timely intervention. Clear, precise, and honest language in describing your health saves invaluable time and forms an indispensable shield, protecting your most vital asset, your health. Moving to our fourth critical truth, we confront the damaging inclination to say, "I'll just live with it." This deeply entrenched belief that enduring pain, discomfort, or diminished function is an unavoidable and inherent part of the aging process is profoundly harmful to your well-being. When doctors hear this dismissive attitude towards suffering, they may, understandably but mistakenly, interpret it as a signal that you are not seeking solutions, leading them to cease offering potential options for relief or improvement. However, persistent pain, chronic poor sleep, unexplained shortness of breath, or the heavy weight of depression are not dignified badges of honor to be stoically worn. They are unequivocal signals from your body and mind, urgently indicating that something is amiss and requires professional attention. Seniors who passively accept their suffering often experience a more rapid decline in their independence and overall quality of life compared to those who proactively seek and embrace available help. Modern medicine, with its advancements, offers a vast array of effective treatments and therapies specifically designed to significantly improve comfort, restore function, and enhance well-being at virtually any age. To choose to live with unnecessary pain or preventable discomfort is, quite simply, to needlessly sacrifice your precious quality of life and the vibrant experiences that should accompany your later years. The fifth and arguably most damaging phrase a senior can utter in a medical setting is the seemingly deferential, "whatever you think is fine." While a foundational trust in your physician is undeniably crucial for effective healthcare, a completely passive agreement effectively hands over all control of your medical journey without a personal compass. Such unquestioning acquiescence can, unfortunately, lead to a course of treatments, medications, or interventions that may not align with your deeply held values, your preferred lifestyle, or your personal health goals. As a patient, you possess an inherent and absolute right to fully understand all available medical options, to be clearly informed of their potential risks, and to grasp their anticipated benefits before making any decisions. When you refrain from asking pertinent questions, expressing concerns, or seeking clarification, doctors may unintentionally assume that you either don't care about the details, are fully informed, or perhaps more critically, that you won't diligently follow through with the recommended plan. The most successful healthcare outcomes are consistently born from a process of shared decision-making where your informed voice and preferences are weighted just as heavily as the doctor's expert medical recommendations or the specifics of a prescription. Your active participation is not merely encouraged, it is absolutely essential for personalized, effective care. It is vital to understand that these 5 problematic phrases do not originate from a place of weakness or foolishness. Rather, they frequently stem from deeply ingrained kindness, a sense of humility, and the valuable lessons of generations past that taught unquestioning respect for authority figures. However, the landscape of modern healthcare has significantly evolved, and the intricate complexities of aging bodies now demand clear, assertive, and proactive communication rather than quiet, stoic endurance. Doctors are unequivocally trained with immense knowledge and compassion to help you, but they can only perform their absolute best work when provided with accurate, comprehensive information and when engaging with patients who are actively involved, thoughtful, and articulate in their own care. It is also important to acknowledge a crucial reality. Many doctors genuinely respect and value their senior patients, but they operate under intense time pressures and within often strained healthcare systems. They respond most effectively and efficiently to patients who communicate their needs clearly, maintain a calm demeanor, and express their concerns confidently. This isn't a judgment, it's an observable reality of how the system often functions. Seniors who take the proactive step to prepare simple notes, describe their symptoms with unwavering honesty, and pose straightforward, pertinent questions invariably receive more focused and superior care. Furthermore, families play an indispensable role in supporting their senior loved ones by actively encouraging them to speak openly about their health and, whenever feasible, by attending appointments alongside them. An additional set of ears and a calm voice can serve as a vital safeguard, helping to ensure that no important detail is missed, misunderstood, or forgotten during a consultation. Yet, even when alone, seniors possess the remarkable power to advocate for themselves and profoundly impact their medical outcomes with just a few mindful changes in their choice of language. Aging, contrary to some prevailing beliefs, does not necessitate or justify giving up your voice. In fact, it demands that you use it with greater wisdom, precision, and purpose than ever before. The precise words you carefully choose within the doctor's office can ultimately determine how seriously your concerns are considered, the speed with which you receive essential treatment, and the overall effectiveness and completeness of your recovery journey. Respect in the medical arena is not a concession to be demanded. It is, instead, a profound connection effectively communicated through unwavering clarity, unvarnished honesty, and a healthy affirmation of your own self-worth. The stark, undeniable truth remains. Seniors who choose to remain silent often suffer needlessly and more profoundly, whereas seniors who learn to speak clearly and confidently invariably live healthier, more empowered, and significantly better lives.